Hello everyone, my name is Chittawan Poonsiri. I am currently a project associate at HITAP, Thailand. And my session today is the introduction to decision modeling in health economics. So this is the outline of my talk today, which I will start with what is decision modeling, why and when it is needed, and also how many types of decision models we can use, and ended up with the steps in conducting decision modelings. Decision modeling is a process of creating a structure that could represent a decision problem or a situation for the better understanding to help decision makers see the consequences of the scenario clearer. This can involve a variety of techniques, including the decision tree model, Markov model, or dynamic model. And sometimes when the scenario is complicated, we can use more than one method as well. And the goal of conducting decision model is to provide a clear understanding of implementing those interventions or making those decisions to policymakers. Now you may wonder how decision model can help policymakers understand clearer on the situation. As we use the model to represent the simplified version of reality with the use of mathematical structure that represent the health economic outcomes of a population or a patient of interest, so that the model can first help predict the future of implementing those interventions to let the policymakers see the consequences of implementing the intervention, and also explore the uncertainty of those interventions in case it is implemented, which about the certainty part you will learn more in the next session. So why and when decision modeling is needed? As I've mentioned earlier, the model would be helpful in a complex and uncertain situation. Like the example I've put here is when the healthcare resource is scarce and we would like to allocate the most efficient intervention, or when the policymakers would like to see the potential impact of implementing the public policy. So when conducting the model, we break down the problem into each component parts, and this will help representing the relationship between different factors, which then assess the potential consequences of providing different choices. So the example would be, if we have the new intervention coming, which in this case is intervention B, which we already know that the outcome is better than the current intervention that we have now, which is intervention A, but also the cost is higher as well. So in this case, if you are a policymaker, you might want to know whether the new intervention is good value for money. And by using the decision model, this will help simulating the consequences of applying those interventions in both health outcome and economic outcomes. There are 3 types of decision models I'd like to mention today, including the decision tree model, Markov model, and dynamic model. So decision tree model is a simple way to compare between 2 interventions in a short and fixed time horizon. So as you can see here, starting from making the decision of each intervention and until the end of the model, the decision tree model will not allow the recurrent events to happen. Comparing to the Markov model here, the model is simulating the cohort of each individual through the health states over time, and also allow that individual to stay in the same health state over time, and allow the recurrent event to occur as well. For example, this one, patient starting from the susceptible state can maybe stay in the susceptible state or turn into infected, severe infected, and recover state. Also, patient in the recover state can shift back into the susceptible state or stay in the recover state over time. For dynamic model, which is commonly used for communicable disease, as a model also addresses the interaction between individuals of each health states. For example, in this model, which include susceptible, pre-infectious, infectious, and recovered or immune state, patients in infectious state would have influenced patients in susceptible state to get infected as well. So dynamic model will be able to address these consequences. Okay, so from now, I think you may get an idea of what is decision modeling, why and when it is needed, and also how many types of decision modeling used in health economics. So, for the steps of conducting decision modeling that I will cover today, will include two types of decision model, which is first decision tree model, and the second one is Markov model. So for decision tree model, the steps including first representing the sequence of the event, and then determine the probability of each chance outcome. After that, we will apply the value of those probability into the decision alternative, and then average out and folding back. So starting from the first step, which is represent the sequence of events. So in this case that I would like to give as an example is the sequence of event comparing between two scenarios. The first one is do not operate and another one is operate. So in case of the patient choose to not operate, we might have to imagine what consequences of not operate would be. So we might want to see if the disease is present or absent. If the disease is absent, then this is the end of the model, right? But if the disease is still presented, we might want to know more if it is cure or no cure. So move on to another scenario that might happen if the patient choose to operate. So after operate, we might want to see if the disease is still present or the disease is absent. So in case of operating, if the disease is absent, it is not the end of the model yet, right? We might want to see if the disease is absent because of the patient got operative date or the patient is survived. Comparing to another scenario, which the disease is still presented, we might want to see if that disease that still present can be cured or will be treated as palliative. And if the disease is cured, the patient would survive or dead. And if the patient is survived, the patient will survive in the state of cure or no cure, ended here. In case of palliative care, we might want to see if the patient is survived or dead as well. And in case of surviving, we might want to see if they are cure or no cure as well before ending the model. So after we got the decision tree that already represented all the sequence of the event, right? We will start by applying the probability of each chance outcome. Starting from here again, if the patient choose to not operate, the patient can go either disease present or disease absent. So when we apply the probability of this state, it means that patient can fall only to one scenario, like either the disease absent stage or disease present stage. So we need to make sure that the probability here when combining should be equal to 1, just to make sure that the patient can fall only in one scenario. Again, if the patient is still in the disease present stage, we might have to want to see if the patient is cured or no cure. And the probability of cure or no cure should be equal to 1 as well, when combining. Because patient can fall only in cure stage or no cure stage. Not the same patient can fall into both stages, right? And then we apply all the probability to the whole scenario here. So after we got the decision tree that represents the sequence of the event, and we have the probability of each chance ready, then we will assign the value to the decision alternative. In this case that I will use as the example is the life expectancy. So again, starting from the do not operate scenario, if this disease is absent, the life expectancy would be around 20 years. Comparing to if the disease is present, if the patient is no cured, their life expectancy would be around 2 years. Comparing to the patient with cure stage, their life expectancy could be around 20 years. So we will apply this value into all of the steps here before moving to the next steps. So after we got all the informations ready, next is the step of calculating. So as you can see here, if the patient chooses to operate, but the disease is still present and the patient fall into palliative stage, the patient is not dead here, right? The patient is still survive. So the probability of that patient surviving could be either in cure state or no cure state. The probability of patient to be in the cure state in this case is 0.1, comparing to the probability of patient fall into no cure state, which is 0.9. In this case, if the patient is in cure state, their life expectancy would be around 20 years. Comparing to if the patient is in the no cure state, their life expectancy would fall into only 2 years. So if we would like to compare between the upper node here, we might have to average out the little branch here first. So how can we average out? We will starting from multiplying the probability here, which is 0.1, to the life expectancy of 20, combining with the probability of patient in no cure, multiplied by the life expectancy. So in this branch, if the patient is choose to operate, but still disease presents and fall into palliative stage, but still survive, the outcome would be around 3.8 years, comparing to death, which is life expectancy around 0. So after we got the information from calculation here, you can see that this is the first branch that we choose to calculate, right? We ended up with the life expectancy of around 3.8 years. Then we will do the folding back, which means we will calculate back to the start of our intervention. So after we got the life expectancy here, we will fold back, which include another branch as well. For example, here, the probability of patient in palliative stage to be dead or survive would be 0.02 for death with life expectancy of 0. So this one will be definitely 0, right? Comparing to the patient in survive stage, which the probability is around 0.98, multiplied by the life expectancy we got from the previous slide, which is 3.8. So in this branch, we'll ended up with 3.72 years. So now I think you might get an idea of how the rest would be calculated, right? Again, in this branch, we will starting from multiply the life expectancy with the probability, combining with another branch, which is life expectancy here, combining multiplying with the probability. So in this case, if the patient choose to operate, the disease still present but try for cure, and the patient is survive, this will end up with the life expectancy outcome around 18.2 years. Again, we're trying to continue folding back by, in this case, after we got the 18.2 years here, right? Then we fold back to another step, which is multiply the probability of surviving here with the life expectancy we have with another probability of death, which is equal to 0. So we got the number here, which is 16.38 years for the patient that operate, disease still present but try for cure. And then we continue to do it folding back here, which is for another branch for patient with disease absent but still surviving, which is around the probability is around 0.99, and then the life expectancy is 20. Comparing with another scenario that patient with operative date, this would be another 0, right? So in this branch, patient who operate and disease is gone, the life expectancy is quite high, right? Which is around 19.8 years. And then we continue to fall back to another scenario. The disease still present. Like the patient who choose to do not operate, the disease still present. The patient could be cured or no cure. We multiply again. If there are cure, multiply the probability of cure. And if there are no cure, multiply by the probability of no cure. And then we will have the life expectancy of that branch. So here, if the patient is operate, the disease is still present, we folding back both the patient who try for cure and the patient who palliate by again the same method, multiplying the life expectancy with the probability for try for cure, combining with the probability of palliative with that life expectancy. So now what we have is the patient who do not operate will ended up with life expectancy around 18.38, comparing to if the patient choose to operate but the disease is still present. For now that we have, the life expectancy would be equal to 15.74. Comparing to another scenario, which is the disease absent, the life expectancy would be around 19.8. So after we finish with all the folding back here, we'll end up with comparing between two scenarios, patients who choose to not operate and patients who choose to operate. The ended up here is that patient who choose to not operate will have the life expectancy around 18.38 years, and patient who choose to operate will end up with life expectancy around 19.39. But remember, this is only the easy example to make you understand how the decision tree would be like and how it is calculated in order to get these numbers. Okay, so let's move on to another model, which is the steps in conducting Markov model. So in this step, I would divide it into 5 steps here, starting from first identify your research question, your population intervention comparator and also outcome, and the perspective you would like to use. And then drafting the health state, which will be included in the Markov model. After we have the health states ready, then we have to find the parameters, including the transitional probabilities parameters, the clinical parameters, the cost parameters, and also utilities, if we would like to conduct the cost utility analysis. And then we incorporate all the parameters into the model. The software we can use either the Microsoft Excel or R program, and then we interpret the results. So for the case study of how to conduct the Markov model, I would like to use as an example here is the case study of economic evaluation of EvoShield for pre-exposure prevention of COVID-19 in high-risk populations. So starting from identifying the population intervention comparator and outcome, right? So in this study, the type of economic evaluation we use is the cost utility analysis. The population in our study is the immunocompromised patient or high-risk patient, as you see in the title, including the organ transplant patients, autoimmune diseases patients, and dialysis patients. And then the intervention we would like to compare is that the first scenario, all patients receive the intervention after they got COVID-19 vaccination. And another scenario is that only patients with low protective immunity through vaccination will receive the medication. comparing with the current situation back then, which is the situation that all the patients receive at least 2 doses of COVID-19 vaccines. And the outcome we aim to measure in this study is the incremental cost effectiveness ratio, or ICER. So after we have the type of study we would like to conduct, which is the cost utility analysis, and we already know the peak code of our study, right? So we start drafting the Markov model. So in this case, our Markov model starting with the patient in the susceptible stage, because patient in our study is at high risk, right? So they are not the healthy patient. So patient in susceptible state, we have to assume that where this patient could be in the model. So patient could be maybe stay in the same state, which is susceptible, or patient can turn into infected stage, severe infected stage, maybe recover, or maybe death. Also, we allow patient in either susceptible stage, infected state, or severe infected to be dead as well. And then patient in the recover stage can maybe stay in the recover stage or shift back to the susceptible stage, just like I have mentioned. This is what our Markov model look like. So now that we have our Markov model ready, we need to set the time horizon of our study as well, which in this case we set it into 6 months. And the perspective we would like to use is, in this case, we use the payer perspective, right? And then we have to find the parameters to put in the model. So in this study, the cost parameter we have, first, the direct medical cost from NHSO e-claim data, the price of the medication from Department of Disease Control, the screening cost of anti-spike IgG we received from Department of Medical Science, and then for clinical parameters to see the clinical outcome. First, as it is the medication, the efficacy of the medication from the PREVENT study, and also the proportion of patients with low protective immunity from another literature review, the rate of infection and mortality from Department of Disease Control, and also the mortality rate of general population from burden of disease and injury of Thai population. Another parameter we might need to use is the utility parameter. This one we got from the literature review as well. So after we got the Markov model ready, we got the parameter ready, then we might have to first assuming that how our Markov model would go, how our patient would go. So starting with our Markov model here, patient with susceptible stage that I have mentioned can turn into other stage here, right? But in case of we provide the medication to this group of patients, we assume that patient in susceptible state would shift from susceptible to be recovered, which means their immunity is high enough to protect them from getting infected. And then it would help these patients to reduce the probability to turn into infected or severe infected stage. So after we got our parameters ready, Markov model ready, assuming the situations ready, right? So we start conducting our model using the calculation. So as I've mentioned earlier, there are some software that can use in conducting the Markov model, but the software that we use is Microsoft Excel. So we starting first from the cycle here with the starting patient, and we put the health stage of our Markov model in each column of the Excel, starting from susceptible, infection, severe infection, recover, or death. So for the cycle length, we set the cycle length in our study at 7 days, which means that every 7 days, patient can turn into another health state. So starting from here, patient around 8,000 can turn into first susceptible stage around 3,000 and recover stage around 5,000. Then 7 days later, patient from susceptible stage can turn into infection, severe infection, recover or death. And then we run the simulation until we meet our time horizon of our study. And what we see now is that we have the cost parameter here and also the quality, which is the utility parameter, multiplied by the life year here. So after we finish the calculation, we will end up with the total cost and total outcome. So as I have mentioned that in our study, the outcome we aim to measure is the incremental cost effectiveness ratio or ICER, right? So for those who may not know yet that what is the ICER, it is the ratio between the cost of intervention, comparing between the cost of intervention and cost of comparator, divided by the effectiveness of the intervention, comparing with the effectiveness of comparator. So after we got the ICER results, we can see that how much the ICER of that intervention would be comparing to the comparator we have. So in Thailand, after we got the ICER, we have something called the willingness to pay threshold, which is the green line here. So if your ICER falls under the willingness to pay threshold, this can be represent that the intervention, your new intervention is good value for money. But if the ICER is fall higher than the willingness to pay threshold, it means that maybe the effectiveness is better, but also increase the cost as well. So it might not be a good value for money. Okay, so from what I've mentioned that in some cases, if the scenario is a bit complex, we may would like to combine between two methods, which in this case is the decision tree model and Markov model. So in this study, instead of putting just a number, just like what I have give an example here, they put the Markov model at the end of the decision tree instead. So after we run the Markov model and we find the results, then we put it in here before folding back, just like we have done in the example. So this is just to let you see the clearer perspective of how to combine between two models, which are decision tree and Markov model. So after you see that the economic model is already conducted, there is another method to help you see that your model that you have conducted is valid or not. This is the method called model validation. So as you know now that the health economic model is conducted based on the assumption, right? So in case that you would like to see if it is valid or not, the model validation method would help identifying the accuracy and also reliability of the model. So the model validation techniques, actually there are several techniques that can be used, but the example that I would like to give is including 3 techniques. First is the phase validity, extreme condition test, and also internal validity. So for model validation, the first method is the method that we normally use, which is the phase validity. The things that we use is called the stakeholder consultation. So we invite the clinical expert and also other stakeholders to consult to help us determine whether our model assumption is already appropriate and already cover all the aspects that the disease condition or disease state would be. And this also involves the confirming the accuracy of the conceptual model's logic and assessing the rationality of the input and output relationship within the model as well. So another method is the extreme condition test. This is when we put the extreme value of the parameter added into the model and see if the structure and the output is reliable or not. So for example, if the intervention is shown to be extremely better outcome, or we put the extreme value of the really better outcome, this should reflect on the lower ICER results. And another step is the internal validity. This refers to the extent to which the results of an economic model accurately reflect the relationship between variables being studied and the degree to which they can be attributed to the specific factors under investigation. So after we have talked about several types of model, now you might want to know that how to choose the model to fit the study that you would like to conduct. So starting from the decision tree model, as you can see, it is the simple way to conduct the decision modeling, right? So the decision tree model, the diagrams the risk of the event and state of the nature over the fixed time horizon. So for a decision tree model, I would say it is best suited for the intervention that relevant the time horizon is quite short or fixed, and would recommend for the acute intervention with no recurrent, because as you can see in the model, they are not allowed the recurrent to occur, right? Comparing to the Markov model, this is the model that simulates the hypothetical cohort of individuals through a set of health states over time. So in Markov model, they allow patient to recurrent or to move to another health state. So the type of decision is best suited for the modeling intervention for disease or condition that quite chronic or involve the risk over a long time horizon. And this, as I've mentioned, this Markov model also take into account the recurrent events. And the last one that I've mentioned earlier is the dynamic model, the one that I've mentioned about the infectious disease. This is the model that allows the form of interaction between individuals of different health states as well. So in the dynamic model, it take into account the interaction. So it is recommended when the interaction between individual needs to be taken into account. For example, the infectious disease. So let me introduce all of you to our online resource, which is the free resource called GEAR. This is the free online resource to guide the economic analysis and research. You can access using the link here, www.gearforhealth.com. So you may wonder why I have to introduce this GEAR resource to all of you, right? So the GEAR is the online resource that collects the available information with the aim to offering the advice and solution to methodological difficulties that in case that you already conduct or plan to conduct the economic evaluation. What are the methodology difficulty that you may face that the researcher already encountered? In GEAR, you can also consult the experts as well. So it would be helpful if you would like to start conducting the economic evaluation research. And also in GEAR website, you can see the program called Plant a Tree, which is the open access decision tree builder. This can help you with the conducting the decision tree model by downloading the Plant a Tree program and add into your Microsoft Excel. And this is free available, so you can feel free to download and use it. Okay, I hope this session helped you understand more on the decision modeling in health economics. So please feel free to contact me if you have any question based on my talk today. And many thanks to Gunjit for taking care of the Q&A part. Thank you.